what are we eating in this festive season coming up?
You want to consume a big meal, but you're thinking at the back of your mind, everyone is focused on one thing for holiday events, and that is the dessert. So how do you balance that?
Well, for me, I guess I have to change my response. The initial question was, what are we eating this season? I was going to say everything.
Everything. Well, we're finally here. It's been a long marathon, and we're here in the middle of December, the holiday month, to celebrate the birth of an important person, but also the Wellness Effect, the brand new podcast that's collaborating with Sagicor, the University of the West Indies, and Healthy Caribbean Coalition. My name is Kenneth, Connell. I am so excited to be here on the set with two friends of mine who you're going to meet soon. But just to tell you a bit more about myself, I am an internist, a clinical pharmacologist, and academic scholar here at the UWI. And most of my time I spend here at the iconic E.R. Waldron building, the clinical skills site, where our clinical students, I hope you're listening, are upstairs working very hard. We are in the reading room. So all around us, several books, which millennials, Gen Zers may not be too familiar with, but several books are all around us with the medical history as well as some modern texts as well. We are on the set for the Wellness Effect. And I'm going to hand over to my co-UB person, Dwayne Devonish.
Welcome, everyone. And as Kenneth highlighted, I am Dwayne Devonish, Professor of Management and Organizational Behavior. And I have a passion and interest in everything well. And I'm looking forward to the conversation with the team.
Yeah. We have a special guest to the UWI, Akil.
Yes, thank you very much, gentlemen. My name is Akil Ifill, Manager Client Relations in the Group Life and Health Department at Sagicor Life. Our responsibility is to ensure all our corporations across the island, and we take that very seriously.
So listeners out there, here's what I found out just before we got started. And that is, Akil actually knows Dwayne in another setting, right? You want to tell us?
Yes, thank you very much. Yes, Dwayne was actually my tutor when I was pursuing my master's at the University of the West Indies. So this is a great full circle moment for me. He doesn't remember me. He looks a bit different. I look a bit different.
True.
But we had some good moments while I was going through my studies for sure. He's a very dynamic tutor. And I am happy to see his progress. He's all over the press these days.
All over the press. And one of UWI's youngest professors. So he must have been lecturing you when he was in high school at
most likely
the Waterford Institution. Yes. That's all we'll say.
Yes.
We have so much to unpack here on the Wellness Effect. In fact, because we are here in the middle of the holiday season, many of us took a while getting here in the holiday traffic and probably are going to be rushing off to do some Christmas shopping soon, but a lot to unpack here for the holiday season.
So guys, I have something on my mind. What are we eating in this festive season coming up? As you know, we have an indulgence culture that is emerging, and we have to deal with it.
That's correct.
There are people who are overeating, eating too much salt, eating too much sugar. What do you guys think about this indulgence culture when it comes to eating during the Christmas period?
Yeah, so indulgence is really hand in hand now with the holiday season. And it has been for some time, right? I started my day this morning with just one cup of coffee because I really do plan to overindulge this evening.
We know, Kenneth.
At a staff party. And no, but it's on a serious note, this happens every year. We consume a lot of extra calories. We get a lot less exercise. The gyms are usually quite empty.
Yep.
We do a lot less walking at work. We spend a lot more time consuming excess alcohol, and we probably have other unhealthy habits that happen around the holidays. So nutrition takes a hit during the holidays. And I guess one thing that we might consider for our listeners out there, how do you balance your caloric intake and your output? Because that's really going to determine your weight gain, right? Your net calorie intake. So how do you do that? Well, I said my cheating was I only had coffee for breakfast. And I'm going to probably have a smaller lunch. And then I may consume a bit more calories in the evening. So I'm calorie counting essentially. And using technology like my smartphone, I can do that. What about you guys?
Well, for me, I guess I have to change my response. The initial question was, what are we eating this season? I was going to say everything.
Everything.
But as you rightfully indicated, many of us overindulge for the season, and then we find ourselves counterproductive when we go into the workplace. The few days we have to during the season, we find ourselves overspending as well. And then you find the case, you go into the new year, you're a bit sluggish in getting back into the routine of work. So I am definitely paying more attention to what I would consume during the season, especially as I get a bit older. I recently turned 35. My body is changing.
So still the youngest person on this set.
Definitely, but body changing for sure.
Yeah.
So I will pay a bit more attention to the frequency and the quantities in which I consume my mother's chocolate cake.
Yeah. No, desserts are a big thing for I mean, how do you balance that, Dwayne? Because you go out and you want to consume a big meal, but you're thinking at the back of your mind, everyone is focused on one thing for holiday events, and that is the dessert. So how do you balance that?
Now, that's an important question because, I mean, Christmas time coming up, you can overindulge in sweet desserts and all types of cakes and all types of chocolate muffins. For me, I deliberately make up in my mind that if today I'm going to eat a small muffin,
right,
I know I'm not going to have a heavy breakfast
there you go.
or a heavy lunch.
So you calorie balance as well, right?
But it's important. And there's something also to consider when you're packing your plate. See if you can get half of that plate with vegetables.
There you go.
As you know, in the Caribbean,
make it colorful.
Half our plate, typically macaroni pie, rice, potatoes.
The chicken leg.
But that's it. Counterbalance it.
Yeah.
Put half that plate at least in vegetables.
And if you know you're going to send somewhere in dessert, you might even have 3/4 of the plate and then just a quarter as your protein. Because you're going to be consuming a lot of sugars for the dessert as extra calories. So you can balance stuff like that.
Yes.
Some people also find it useful not to have a cocktail if they're going to have a dessert as well. So your cocktail is your dessert if you're going to have dessert.
Right. Another thing I think is important too, apart from obviously looking at how you consume foods, is making sure you stay active. Like you mentioned earlier, the gyms are usually very empty around this time.
Except for gym parties.
Yes, of course. I try to take advantage of an empty gym, and I would like to continue so throughout the season. I think it's important for us as we try to monitor the food that we take in. There's still overindulgence lately, so at least you balance it with some physical activity and ensure your overall well-being.
I'm really glad you brought up the gym because one of my patients said to me, he does this thing where he only goes to a Christmas event if he does the gym.
Wow.
So he does the gym and then goes to an event. Or vice versa. Now with 24-hour gyms, you can go to the event and then go to the gym, right?
Correct.
You probably don't want to consume alcohol before going on the stair climb, right? But those are kind of some hacks that you can do.
Yeah.
Do you have any practical holiday hacks for listeners? Like, what are some of the other things you guys are doing around the holidays so you balance the calories?
Yeah. Well, for me, I mean, drinking a lot more water. I think Barbadians do not drink enough water. And as we know, water consumption is very good in terms of energy. It's very good in terms of sleep. There are tremendous benefits when it comes to drinking water.
Yeah.
Instead of taking the elevator, take the stairs. If you're at work,
definitely
put in your steps.
We took the stairs here, guys.
Yeah, it's important.
Take our word for it.
It's important, Ken.
Yeah.
I mean, sometimes we want to go to a shop and the shop is like a few 100 meters away, and we take the car to go to the shop or go to the supermarket. Take a walk.
Take a walk. So interesting, maybe before we started shooting the show, Akil was asking me, how do I know I'm consuming enough water? And this is something that many patients ask me as well. And one simple way is these things called P charts, which are in the restrooms of most gyms in the United States. Sadly, not here, but hopefully some of our gyms in the Southern Caribbean, hopefully you're listening to this. Having a urine chart above the urinal is very helpful because it then allows men to see what color their urine should be when they're exercising. Of course, ladies should not be excluded. You should have similar charts up as well. So you want your urine to be straw colored, so almost crystal clear. As soon as it starts to turn that yellow and even darker orange, it means you're already dehydrated and you need to keep up on it.
Absolutely. Yeah.
And of course, you've got these fancy apps that you can have on your phone now where you can check your water intake. it is annoying. Trust me. The vibration that I'm feeling now is to remind me that I need to drink some more water.
Yeah. Wow.
So, but these things are, they keep your water going, and it also allows you to consume less food, right?
Yeah, for sure.
Is a true thing. I think it's important to make those substitutes for the sweet drinks when we're consuming the food. Trade them off for water, like Dwayne said and Kwame said, to stay hydrated. You're making sure too you're actually quenching your thirst. Many a time we see persons with a Coke for breakfast. Right?
There you go.
That's a very big breakfast beverage.
Yeah.
In Barbados.
Definitely.
And so we have to make those trade-offs, those changes, so that we ensure that as we go through the season, we live beyond the season too.
Yeah,
right?
That's important. Getting past the holidays.
Yes.
And I'm going to take some time to hydrate. There's so much to unpack here in the wellness effect, but we're going to come back after break. And if you think you've heard the best of the hats, stay tuned to some more interesting things that are affecting all of us for the holiday season.
Welcome to the official launch of our community health screening program called Sagicor Cares.
I am really not the brainchild of this program. The two persons responsible for this program that are not aware that they're responsible are actually sitting in front of me. Senior Minister Jerome Walcott, who leads the Ministry of Health and Wellness and who is ultimately responsible for the National NCD Commission, and my good friend and Commissioner Suleiman, while having discussions at one of the NCD Commission meetings. After the meeting, I said to the chair, we must do something about the NCD issue in Barbados. And Sagicor has a responsibility to actually find a solution or be part of the solution to what is required in Barbados. So Chair and Minister, thank you for leading the way. Sagicor has responded to your call.
Barbados, like many other countries in the Caribbean and globally, is waging a critical battle against non-communicable diseases, otherwise known as NCDs. These conditions have emerged as a formidable threat to public health, with a staggering more than 80% of the deaths recorded in Barbados being attributed to NCDs and cancer. This alarming statistic underscores the severity of the crisis and its profound impact on the health of our population. NCDs, which include inter alia conditions like diabetes, cardiovascular or heart and circulatory diseases, and certain cancers, have become a crippling burden on our healthcare system.
The Sagicor Cares Community Health Screening Program is more than just a health check. It is a call to action. It is about building healthier communities, one person at a time. We are excited to see how this program will grow, and we look forward to the positive impact it will have, not only across Barbados, but hopefully across the territories in which we operate, as we seek to build this out.
The launch of our Sagicor Cares program would not have been possible without your support and assistance. And I will end with the hashtags of the NCD Commission. Hashtag Healthier Barbados, hashtag Healthier Me, hashtag Sagicor Cares.
All right, so gents, we have been well hydrated by Sagicor. Cheers for the holidays.
Cheers for the holidays.
Good.
This is water,
Folks. So no alcohol in here at all. And we're back on the set of the wellness effect. And here we're talking about unpacking some more things for the holidays and keeping you healthy. Something that's always crossing my mind is people somehow think that staying healthy for the holidays is going to protect them for years to come. But did you guys know that during the holiday season, the impact of stress on health is significant immediately? Mm-hmm. Here's some interesting data. So in the United States, right, the number one risk period in terms of incidence of heart attacks occurs, guess which day?
Christmas Eve.
Christmas Eve, right?
Yeah.
And this is only followed
yeah.
by New Year's Day. So these are two peak seasons. So stress,
Yeah.
and a lot of you out there listening are probably medically aware or medically alert or, familiar with Dr. Google. And you probably know that stress causes a lot of changes in hormonal balances, including one important hormone called cortisol. And it is thought that this does help to regulate or dysregulate your blood pressure and other risk factors, such as your blood sugar control. So your risk really does increase. Stress really is killing us slowly, but especially around the holidays. We also don't sleep as well. So the whole biological rhythm is offset.
Yeah.
So to the listeners out there is real data out there showing that people are at an increased risk of having events, sudden cardiac deaths around the holidays. So be careful out there.
Yeah. Ken, I was thinking about this whole relationship between the quality of sleep and the quantity of sleep and health generally. What does the research actually say?
Yeah. So this is a big thing, Dwayne, because I have to admit, as a clinician and insomniac, I have ignored this for most of my career. And of course, internship is an occupational risk because we don't sleep, right? But here's something else that's interesting. So up until, I would say about 5 years ago, the American Heart Association, one of the main leaders in providing health information for patients, so not for us, for patients out there, getting us to live healthy with this package called Life's Essential 8. So Life's Essential 8 was actually Life's Essential 7. And guess what they added? Sleep.
Wow.
Sleep is important. Sleep is an independent predictor of cardiovascular events. We all are not sleeping enough. So we need to get on average between 7 to 9 hours of restful sleep. When's the last time you had that?
I'm slightly in
I
trouble.
can't relate.
There you go,
slightly in
right?
trouble.
So we all on the sleep, and we think that we can catch up with it on weekends, but you can't. You need consistent, high quality sleep. But the good news is there's several things we can do to change that, improve our sleep quality, such as stopping the caffeine. Okay, I'm guilty. After 2 p.m.
Guilty,
so make sure your last cup of coffee is around lunchtime. Don't go out to dinner and have caffeine. Also, alcohol is a stimulant. So as you're drinking those cocktails thinking you're going to simmer down, it's actually going to keep you awake unless you're really intoxicated, which you don't want to get, right? And other things such as dimming lights at home, making sure there are no distractions in the bedroom, that it's too brightly lit. Some people use different color lights, of course, to tone down as well and to get a hormone called melatonin up as they're getting ready to prepare for sleep. Sleep is important.
Yeah, it's absolutely.
And in addition to what you mentioned too, screen time. So a lot of the time we stay up late, we just scrolling TikTok and Instagram and Nation News for the older folks like us to see what's happening. And we don't put them down soon enough to get adequate rest. And before you know it, you hear the clocks crowing, it's time to get up and go again.
Yeah,
So
no, that's so true.
It's very important to sometimes be able to shut off from the devices that keep us active, even when we want to rest. The stimulation mentally
It's still there.
correct.
Yeah. And Dwayne, are you a techie person? Do you have your cell phone with you in bed?
I keep my cell phone in my drawer by the bedside because of the radiation. Because that's a whole different wellness
right,
issue
okay.
altogether.
Correct. That's correct.
Yeah, it's important. I've heard people tell me that, they would sleep for 3 hours and they say, well, I'll get the next 3 hours in the afternoon.
Right.
And I'm saying, but the whole idea of quality of sleep is that it has to be
Continuous sleep, yeah.
And it's so important to educate,
Yeah, you can't front load, guys. You can't kind of have 3 hours and say, I'm going to take my 3 hours now because I'm
you
only going to get 3
compensate for
hours
it.
tonight. It needs to be continuous sleep because you need nice, deep sleep as well. So as we talk about deep sleep, there are some medical conditions that keep us up at night. Some of them are brought on by our doctors, present company included, right? Such as medication that keeps you going, passing a lot of urine at night.
Yeah.
Sometimes these adjustments have to be made. So for instance, you may have to dose your diuretic or water pill a lot early in the day so that it doesn't keep you up all night going to the bathroom, right? Also, if some of us do have sensitive kidneys, and if you are kind of staying well hydrated during the day, it's time to cut back on your water intake as you're approaching nightfall, because that will just keep you up all night, right?
Yeah.
I'm guilty. So what I've had to do is remove the mobile phone from my room completely and charge it in another room.
Yeah.
Because I will be tempted to check, especially if I'm going up to the bathroom.
Right. I want to touch on something you mentioned earlier in terms of knowing your numbers, and I like that led into our conversation about having sleep.
Yeah.
Now, obviously, we spend most of our time at work, and I think the workplace has a role to play in the wellness of the employees that they hire.
For sure.
Some of the ways that we could generate some of this deep sleep that we need at night is to have employees engage in physical activity around the office, right? Whether it's an exercise for 10 minutes, right? You give teams a challenge to...
And you guys at Sagicor are doing a lot of this stuff. I've heard
That's correct.
through the grapevine, there's a lot of healthy stuff happening at Sagicor.
Yes,
So what
yes.
stuff is going on?
Yes, so we have something called Fitness Fridays, and the team across...
So tomorrow?
Yes.
Yeah.
Tomorrow, we're likely to have a challenge that will be sent out by our teams to gather in various areas of the building to be active. And that, again, is part of our wellness messaging. We do sell insurance, but at the core of that are the people. And we want to make sure that the people in our communities are healthy, and that starts at home with our employees.
Right.
So these activities, I find, apart from the physical element of the exercise, they give persons an opportunity to join with colleagues in an informal way. We usually...
So team building?
Yes, team building. Thank you. Yes, so we would team build for these exercises. You record the video.
Sounds like a lot of fun, actually.
Correct.
Yeah. I'm not changing jobs.
Correct.
You Sagicor sounds attractive,
Yes.
but yeah.
So these are some of the things you could do. Water challenges. I remember a few years back, one of the teams that I was on, we had within the team a water intake challenge. So at the end of the week, somebody would get a prize for consuming at least enough water for the day, because that's not something that we do.
Yeah.
Right?
Yeah.
So these are just some of the things that I think could lend value to the employees at
In
our
the
companies.
workplace.
Yes.
Yeah.
To at least form habits that will carry them through the season as well.
So
I'm happy to hear this because as not many Bajans would know that Barbados has a national workplace wellness policy.
we heard about it just before this program, people. I'm just joking.
No, it's important. It's important. We are the only country, Ken, that has a national workplace wellness policy that seeks to advance healthy and well working behaviors. So like Sagicor, if you're doing something that is going to be benefiting employees from a healthy perspective, it is going to benefit the bottom line.
So Dwayne, I think that the whole topic of workplace wellness, it opens up a can of worms, but good worms, healthy worms, right? Because we spend a lot of time at work.
Yes, we do.
We spend a lot of time at work. We socialize at work. Our eating habits are largely at work, right? So what are some of the things we can do at work? The workplace wellness package speaks to that, because you're not just talking about eating and physical activity, but wellness in its whole domain, and there are like various domains of wellness in that package.
Yeah. So Ken, there are 9 dimensions,
to the
wellness policy, and of course to the wellness profile of any individual.
Right.
So we have physical wellness, we have environmental wellness, we have psychological wellness, social wellness, intellectual wellness, financial wellness, cultural wellness, spiritual wellness. So it's a range of wellness dimensions that we're tackling. And this is not to say that employers are being placed exclusively the burden of taking care of that health and wellness profile in the organization. But we're saying it's a shared responsibility.
Yeah, of course.
And I like to put it this way, that if you're in a partnership and you are considering improving a particular area, that each party has a role in delivering that.
Yeah, I mean, I certainly say this all the time in my practice with patients. It's a partnership. It's not just about what I've recommended, but it's what you agree to do as well, and how you how can we build that relationship to come hopefully with a common goal, because your health is my interest as well, right? And of course, Sagicor, you're interested in people's health as well. You're an insurance company, but of course you want to see wellness as well. So the 9 dimensions of wellness are important. I heard financial wellness, and I know that you're next, Akil. So financial wellness, how does that work out with your claims, especially around the holiday season, like now?
Okay, well, that's a great question. Firstly, like we mentioned before, persons tend to overdo in terms of the consumption of foods and whatnot. You will usually find a case where health is then neglected or postponed into the following year. So we would usually see an influx of claims as it relates to persons having their physicals checked and finding
physical
out.
Exams,
Yes, physical exams to see how they're doing. Usually they would have packed on a few pounds between the coconut bread and the chocolate cake and whatnot. But these things, while we do cover them, the preventative care aspects on our policies, they do carry a cost. and the claims, impact the premiums.
The premiums,
So
of course.
when you go through the season, you should always ensure that as you allocate for spending and buying gifts, that you also allocate to pay your premiums for your policies, because this will help you going into the new year. Because a lot of the time we tend to be catching ourselves.
January is the longest month.
Correct.
That's a great financial wellness tip there, actually.
That 8 weeks, that it feels
8
like
weeks
to
in
get
January.
that January
8
check.
weeks,
So you
yeah.
should always, you should always ensure that you have your premiums allocated for, so that going into the new year, you have some coverage that can assist with the cost of the services that you need to get your wellness.
I think that's a great financial hack. I mean, we've been speaking a lot about health hacks, but financial hacks as well. Getting your premiums in place before January when you're broke, right?
Yes.
Because your health is going to be important in January. And I have to say, in January, the gyms get full again, but also the doctor's offices get full. Because all of a sudden people realize, I still have high blood pressure and diabetes, even after all the ham and fruitcake, right? But these are things that culturally in the Caribbean setting, I know that we're speaking to a Caribbean audience predominantly, and the Caribbean culture is really to do a lot of overindulgence around Christmas. And there might be some historical context here, because some people, some families, especially lower middle income families, may only have been able to afford certain things for the holidays. So it's kind of a time to celebrate and to really splurge.
And that's actually a really great point, because you will find when it comes to insurance coverage, persons would tend to deprioritize the payment of the premium because, enjoyment, right?
Yeah.
You have something more pressing. Yes, you have something more pressing that you wish to do.
Right.
And you kind of put back the premium payment because, it's just insurance.
Yeah.
But the thing about insurance coverage is that it's there for the unpredictable moments.
True.
You don't know when something will come.
Something's going to happen.
So you should always ensure that you have that premium allocated, that if something does happen, that you can't predict or you don't see coming, because you didn't get that preventative care check, that physical exam, that you will be well positioned to manage it as it relates to the cost.
I'm so glad you brought the whole preventive care, because I have to say, even as an internist, I wasn't really sold on this whole preventive care examination. Until last year in the United States, we have published large data showing that the annual physical exam is critical, especially in men. So go out there and get your physical examination. We used to really push in what we call kind of risk profiling and risk-specific exams. So for women, that included things like getting the pap smear examination, breast examination. Men, you're talking about colon cancer screening and, of course, PSA and prostate health. But the annual physical examination has taken center stage again. So go out there, have a conversation with your primary care doctor, and make sure. I usually have mine not at the beginning of the year. I have mine for my birthday in August. I'll send the date so you guys can send me gifts. It's not too late. It's far enough for the holidays, so I can still get 2 sets of gifts. So I mean, I think that's important. But all this is having a toll on your mental health. So it doesn't have a toll on our mental health. We're going to take another break here and rejoin the podcast in about 2 minutes, and we'll get some steps in as well. But stay tuned.
Welcome to the official launch of our community health screening program called Sagicor Cares.
I am really not the brainchild of this program. The two persons responsible for this program that are not aware that they're responsible are actually sitting in front of me. Senior Minister Jerome Walcott, who leads the Ministry of Health and Wellness, and who is ultimately responsible for the National NCD Commission, and my good friend and Commissioner Suleiman, while having discussions at one of the NCD Commission meetings. After the meeting, I said to the chair, we must do something about the NCD issue in Barbados. And Sagicor has a responsibility to actually find a solution or be part of the solution to what is required in Barbados. So, Chair and Minister, thank you for leading the way. Sagicor has responded to your call.
Barbados, like many other countries in the Caribbean and globally, is waging a critical battle against non-communicable diseases, otherwise known as NCDs. These conditions have emerged as a formidable threat to public health, with a staggering more than 80% of the deaths recorded in Barbados being attributed to NCDs and cancer. This alarming statistic underscores the severity of the crisis and its profound impact on the health of our population. NCDs, which include inter alia conditions like diabetes, cardiovascular or heart and circulatory diseases, and certain cancers, have become a crippling burden on our healthcare system.
The Sagicor Cares Community Health Screening Program is more than just a health check. It is a call to action. It is about building healthier communities, one person at a time. We are excited to see how this program will grow, and we look forward to the positive impact it will have, not only across Barbados, but hopefully across the territories in which we operate as we seek to build this out.
The launch of our Sagicor Cares program would not have been possible without your support and assistance. And I will end with the hashtags of the NCD Commission. Hashtag Healthier Barbados, hashtag Healthier Me, hashtag Sagicor Cares.
Mental anxiety. I was just talking about how stressed I get around the holidays. What about yourself, Dwayne?
I think I have a problem of overcommitting.
Overcommitting.
Especially closer to the Christmas time. I was just checking my phone just before we came back, and I'm saying to myself, why did I sign up to do that?
Yeah.
And
especially in December.
You know, and we were talking about physical health just now, but mental health is such an important thing. You know, I mean, I always say that all of us have mental health. At any point, it can be affected. The same way that all of us have physical health.
Exactly.
So there are fluctuations that happen in our physical health, and there are comparable fluctuations that can happen with our mental health. The problem is that mental health tends to be more inconspicuous.
Yeah, the softer side of health, which should actually be the stronger side of health. And what I've always been curious about is, do you actually get a lot of mental health claims at Sagicor?
We get a lot of mental health queries for sure. We've seen a trend now of persons asking for benefits that cater to the mental side of health, and I think it's a good thing.
It's an excellent thing,
It's a trend or looking in the right direction, because at the end of the day, our mental strength is what propels us to do well in the positions that we're in, and promote the messaging that's needed for our communities to be well holistically.
It also means that people are a lot more sensitized now about their own mental health.
That's
and us as clinicians, we are actually advising them to get mental health expert help, and hence why you're seeing more claims, right?
Yeah.
So I think that's and I always wondered how that influenced insurance claims. Are you actually seeing it? But you are, which is a good thing.
So we do have certain benefits that would cover aspects of mental health treatment. Right, so we would see an increase of those, especially for younger persons on our policies, which again is telling, right?
Yeah.
So it is important to join the mandate or the approach for the physical wellness with the mental wellness as well. We spoke about different challenges you could do as teams within companies on the physical side, but I think these also lend some help to the mental side, because you get a break from the work, and you get to have a little more camaraderie with persons that you may not interact with heavily on day to day.
Yeah.
And those things could go a long way in at least making a work day feel lighter, given all the activity that we do day by day.
And for some people, it's a break from the home environment where a lot of the stressors might be occurring. You know, it might also be at work as well. Recently, I attended a physician wellness seminar, and one of the questions that we were introduced to, just to get the conversation going, is saying to your workmate, you know, how are you doing today? Is everything okay with you? In a private setting, but giving them the opportunity to open up.
Yeah. Interestingly, though, not everyone opens up, because there's this natural relationship between a person willing to confide in you and the level of trust that they have. And unfortunately, there are many people out there who don't trust others enough to share information. And we have this problem in the men, the population of the men.
It may even be a bigger issue. It's definitely a bigger issue among men for sure, and we see it among our friend groups all the time, where you could share information with one of your male friends and he would say, man, drink a beer.
Yeah.
You understand?
Yeah.
They kind of dismiss whatever is being brought, and those types of things could be damaging. As we get a little older in life, I start to appreciate more the ability to speak freely about the things that impact my mental health, because I know that without it in place, I can't do what is required of me, whether at home or at work.
Yeah. Of course, one of the main environments where men kind of get to offload that whole mental health stress is in a barber shop, which is why I go to a barber every single Sunday morning. Shout out to hairline barbers. And I know you're listening. If you're listening, you know I don't really need a haircut every Sunday, but I still do it to unpack my mental health. And it's so important because you get the opportunity to bounce ideas off other people who are there, obviously.
Yeah.
It's an environment that seems safe. I mean, ladies, you may not know this, but men, we have a special bond with our barbers.
This is fine.
Yeah, we do.
Every Thursday.
And they can tell you if they're cheating.
Correct.
There you go.
Every Thursday.
That's another hack. Thanks, Dwayne.
Yes. So who's pulling about your hairline like that?
Yeah, there you go. So it's an important opportunity to discuss mental health. And the other thing that I thought about in the workplace is how Gen Zs have changed the whole acceptance of mental health.
Yeah.
I get to interact, luckily, with a lot of medical students, and even in conversations when they're telling me, I took yesterday off a mental health break, I think, my generation would never say that.
Yeah.
I mean, but they've normalized it. Like, listen,
Which is a good thing.
it's
That's
a good thing.
It's a good thing.
Exactly.
That's a
And
great thing.
Of course, many of our young people have professional mental health coaches, and as they will say, the shrinks, and they're not afraid to say or to speak about it with their friends or
fashionable.
family. It's very fashionable, right?
Yeah.
And that is something I think we should give a lot of credit for to the Gen Zs for sure. Bringing mental health to a point of highlight and priority. Like you mentioned, that's not something that was very common among previous.
In our generation.
Correct.
I'll just jump into your generation now that we're here.
It's important.
Yeah, so for even, I know, Dwayne, you're an older millennial, I'm a younger one.
Yeah.
But for our generations to get the job done.
Just
if
get
you're
it done.
studying,
Yeah.
get those A's and come home.
Correct.
Yeah.
If you're at work, behave yourself, do what's required, bring in that check, bills have to pay, right?
Yeah.
So I credit Gen Zs a lot with having no fear as it relates to looking at other aspects of health that would have otherwise been ignored for a long time.
The right to health, the right to good mental health as well. And of course, this all got unpacked during the pandemic, which luckily is behind us. Remember, think back to a couple Christmases ago, we were all at home, in isolation, or wearing a mask, or, it was a horrible experience. And certainly coming out of that, interestingly, for the holidays, a lot more focus has now been on infectious diseases. I know we've been speaking a lot about non-communicable diseases, but infectious diseases around the holidays, COVID is still around. Along with our common friends out there that usually come to all these parties unannounced, like flu viruses and gastro, right? So every year, every primary care doctor around the world will tell you the incidence of the flu goes up. We don't have a winter, but we do have a winter tourist season. So from October,
it's important.
Our flu rates go up. Infections around the holidays. What COVID has taught me, especially at these kind of events, is always hand sanitizing.
Very important.
If you're going to be in a space, make sure it's ventilated. Try to hold events outdoors. Luckily, we don't have a winter, so we can hold a lot of events outdoors. And also, be careful how you're putting stuff down, and also how you're inspecting your food. Chances are, if it doesn't look right and taste right, don't eat it.
Correct.
It's important.
Just put it in the bin.
Just put it in the bin.
All of these Christmas parties is something that is a must. We have
pretty
to be
important.
extremely careful.
And we bypass a very important habit that persons generally tend to overlook. You have to wash your hands. Please.
Wash your hands.
Please. Wash your hands.
Hand and soap.
I may overwash mine, according to some people, but it's a good habit.
Sagicor team is laughing.
You're touching everything every day. You end up touching your face, touching your food. So it's very important. At a very basic level, wash your hands.
And be careful with the utensils. Don't use utensils that you're going to use to carve meat on the fruits and vegetables. Because
that's it. Mixing.
The mixing is a really a big thing. And if you are in an unfortunate circumstance in your territory, because we're not just talking about happening in Barbados, and there is a foodborne illness outbreak, remember your responsibility legally to report it. Some of us we always say, I don't want to get the restaurant in trouble, but it's always helping improve the system as well. And
correct.
so those checks that need to be in place, that our public health specialists in the various territories can assist us with, we need to get on top of that and try to report these things as they occur.
Yeah.
It's all important about staying healthy for the holidays. So here is a Connell holiday hack. So in the Connell household, we've been trying to reduce calories consumption, and you know what that's going to come from? Desserts. So we no longer prepare desserts. We have our Christmas lunch, right? And then to have our desserts, we go out to a hotel somewhere and we have a dessert afternoon. That way there isn't a lot of cake left over and all that at home, right? And that's how we kind of cut back on the calories. Any Christmas hacks that you have, or any big plans for the holidays as we bring this podcast to a close?
Well, definitely still working on the hacks. My diet and the wellness on the whole as it relates to physical activity and not is a work in progress. But in terms of plans for the holidays, I plan to dedicate most of that to spending time with my family, my dogs.
That's important.
I love them.
Mental health.
Yeah,
social
exactly.
wellness.
Correct. That goes a long way for sure in helping you reset to come into the new year. Naturally, there'll be a lot of cleaning and changing of curtains and whatnot.
Yeah,
you know
stuff
how
that
it's in
we all
Caribbean.
love to do.
Yes.
Not.
And in terms of what I would do for Christmas, I tend to have a nice breakfast. Yeah.
So you're a Christmas breakfast person?
Yes, I will have a nice breakfast, and for the rest of the day, I wouldn't eat very heavily. I may have a slice of chocolate cake. I can't turn that down too often. Right? But yes, that will basically be my plan for the season for sure.
Doing any big plans for the holidays?
For me, I want to get in a bit more physical exercise.
So you're going to be the one person in the gym on Christmas Day?
Exactly.
Well, actually, I'm actually taking it out in the open. I want to get in more cardio.
Wow.
Yeah, a bit more cardio.
I'm
actually going to Hillaby. I want to go up the hills.
Mount Hillaby?
Mount Hillaby, yeah.
For those of you who don't live in a flat island like us in Barbados, Hillaby is like one of our highest points.
Yeah,
it
It is our highest point.
It
really isn't that high. But anyway, it's a great hiking spot.
Yeah. So that's my plan. I want to increase my physical activity. I still want to take care of my sweet tooth a bit. And I think not overcommitted. Going into January, we talk about resolutions, guys.
Yeah.
One of my resolutions, I'm not going to overcommit. I'm going to manage my workload much better, so I get that personal work balance.
I think that's such an important closing point there.
Yeah.
And thanks for putting that out there. And I'm going to go into my schedule. I just saw Ordine enter the space, so I'm going to refuse meetings in the new year, and I'm going to blame it on you, dude.
I got your back. Don't worry.
I mean, guys, cheers. All the best for the holidays.
Yes.
And we have completed the first episode. Can you believe it? The first episode is already done for the Wellness Effect. We have had such enjoyable conversation.
Definitely.
I know we're going out there now and get a lot of shopping done that we've kind of missed out on as the holidays are approaching. But we hope you enjoyed it, and we hope to see you or hear you or you hear us throughout the Caribbean and throughout our whole global space as we enter into episode number 2. All the best to you and your family for the holidays. If you're not a religious person celebrating the holidays, have a safe one. Whatever you do, get some steps in, get some water in. Watch out for your premiums.
Correct.
This has been the Sagicor UWI Healthy Caribbean Coalition podcast.
Have a great holiday.
Have a great holiday, everyone.